the title of this presentation is Glaucoma, a local or systemic disease. And there are several studies that place glaucoma as a systemic disease, not completely related to the eye. In the article of this year, a group of scholars from the University of Philadelphia concluded that increasing evidence implicates the contribution of low cerebrospinal fluid pressure, autoimmunity, neurodegeneration, and impaired autoregulation towards glaucoma pathophysiology. Another article entitled Glaucoma and Systemic Disease, published in 2010 by Salim, said that knowledge of systemic disease and potential drug interactions, especially between viral, systemic, and glaucoma medication, is important for the safe management of glaucoma patients, linking the general health of the patient's body with the intraocular pressure. And another study from last year, in this study entitled Systemic Disease and Long-Term Intraocular Pressure, Mean, Peak, and Variability in Non-Glaucomatous Eyes, he stated that the object is to assess the long-term longitudinal relationship between systemic disease and intraocular pressure, mean, peak, and variability, including diabetes, hypertension, body mass index, and smoking status. However, in my daily practice, most of the doctors will treat glaucoma as a localized disease. Most articles that can be found regarding Western medicine treatment comprehending the physiopathology of the disease follow that thought. As I said in the beginning, this study was based on the idea I had during the treatment of my patient that I explained to you in the first presentation. I want to repeat again. The patient who had pain in the legs and improved in the glaucoma. And this interesting case became the cornerstone of my first research, trying to comprehend how the treatment based on the root of the problem could treat different disease and symptoms simultaneously and with the same methods. As I had great success, I showed you that I was a research and did the presentation in the Harvard in 2015. And during these studies, I would attend, I did in my study as a research at the University of São Paulo, I attend in the ophthalmology department, the glaucoma patients. And we started this research treating some patients with acupuncture and the auricular acupuncture. And I would like to show you some results. Here is to show, here is in Portuguese, sorry, but I'm demonstrating only some patients in the beginning of this research. That some patients like this one, he had 16 years old. We did a measurement before the acupuncture treatment. This patient was 9 in the left and the right eye. And after 15 minutes, we did the acupuncture, and we showed that after acupuncture treatment, auricular acupuncture, the pressure was reduced, and after 30 minutes, the eye pressure were measured again and maintained 4. And in this case, we are showing here another case that at the beginning the patient had 8 in both eyes, and after 15 minutes of the acupuncture treatment, the eye pressure reduced to the half, 4 and 4, and after 30 minutes it returns to 8 again. And here we are demonstrating another treatment Here, for example, this patient had a 77-year-old. She had 14 in the right eye and 15 in the left eye. And after 15 minutes, the eye pressure reduced after acupuncture and reduced from 15 to 13. And after 30 minutes, reduced from 14 to 14 to 14 after 30 minutes, and after 30 minutes reduced from 15 to 12. These are only some demonstrations. We are demonstrating here again that this patient at the 0 point was 16 and 12, and after 15 minutes of the acupuncture reduced from 16 to 30 and to 12 to 14. This in this case was increased and maintained from 16 to 14 after 30 minutes. And here in this case, this patient was 11, after 15 minutes go to 10, and after 30 minutes we didn't measure again. And we can see in all these cases that the majority of the patient reduced their eye pressure after acupuncture treatment. And for this presentation, I have prepared 2 case reports in this presentation. And the purpose of this presenting the study is to explain what was done and what is systemically involved in the glaucoma. And the patient started treatment due to high intraocular pressure, not controlled with eye drops and topical medication. And a year before, he found out he had 7% of his right eye. He is a 59-year-old male patient. But this is not his eye. This is only to illustration. And this patient also have a systemic high systemic pressure, and it was using medication to control it. And he also received the Chinese dietary counseling. I did the apex bloodletting with auricular acupuncture. And despite doing treatment with eye drops and topical medication for a long time, the intraocular pressure was not low and was around 23. And during the treatment, I noticed the patient had the umbilical hernia, what is now in TCM to be linked to the extreme lack of energy. And the patient believed that this umbilical hernia was normal, but since he had this hernia since he was born, and I recommended to do the chakras energy through the chakras radiesthesia procedure, and all his chakra demonstrated that he were in the lowest level of energy, as I told you. And we began to replenish these chakras using high diluted medication with homeopathic medication and crystal-based medications. And I will show you now the second case report. Is a 53-year-old female patient who had suffered chronic bilateral and in that case, the patient reduced his eye pressure from 33 to 14. And he continued to use the eye drop because his ophthalmologist maintained the eye drops, but he could reduce his eye systemic arterial pressure medication, and he stopped to use this kind of medication because his systemic pressure was lowered with this treatment. And the second patient, she had an open-angle glaucoma for 21 years, and her intraocular pressure was 20 and 26 in the right and left eye, respectively. And she had trabeculectomy in the right eye in 1991, and in the left eye in 1992. Also, she had cataract surgery in the right eye in 2004, and the optic nerve showed severe hollowing bilaterally. And in April 2007, a valve for glaucoma was placed in her left eye, and post-operatory intraocular pressure increased to 40 after the surgery. And she came to my clinic specifically to treat her glaucoma after hearing from her daughter, who also was my patient, that acupuncture could benefit her. And she performed 20 sessions of auricular acupuncture with mustard seeds. And after 20 sessions, her intraocular pressure decreased from 40 to 13 and 11 mmHg from the right and left eye, respectively, and gradually the patient was able to withdraw the eye drops. And after a successful treatment in 2007, only now the patient returned to my clinic 12 years later to another radiesthesia procedure, and I demonstrated that all her chakras energy were in the lowest level too. And she began to replenish the chakras energy, and the eye pressure became continue in the normal range. And here is to demonstrate the Chinese dietary counseling and and in this case reports all described presenting improvement in the glaucoma symptoms, not related to the use of the eye drops, once many of the patients were using the eye drops for years without results. And the treatment with the eye drops may not be effective because the imbalance is systemic. According to the Arnold-Schultz law created in 1888, small doses stimulate, moderate doses inhibit, and overdoses kill. And the use of eye drops may not be beneficial because they were all metabolized in the liver. That I told you in the first presentation that the liver is the main organ that is responsible for the eye. And that's why sometimes this patient could have this energy imbalance alteration due to chronic use of the eye drops. And you can see that the majority of the patients that use these eye drops had redness in the conjunctival. And because the redness in the conjunctival in the TCM means that these patients are generating the internal heat that I told you in the beginning of the presentation, that when the patient has energy deficiency, they could have the internal heat formation leading to the conjunctival hyperemia. And this is another presentation that I did, and it is also published in the journal. You can read. And the conclusion of this study is that in this presentation, glaucoma is a systemic and not a localized disease. And being systemic, we have to treat the whole patient and the whole body, not focusing the treatment only in the eyes. And glaucoma is only a reflex of a systemic energy imbalance. And to achieve better results, it is important to treat the root of the patient problems, that is the energy imbalances, and not only the patient symptoms, that is the high intraocular pressure. Here is the publication of this presentation, and here is the publication, How to Replenish the Internal Organs. And it is a quote of Hippocrates, foolish the doctor who despised the knowledge acquired by the ancients. And thank you for listening. If you have any question, please ask me. I will be happy to answer you. Thank you.